Exercises with cue walk. Normal walking. Typical gait training with the use of cue walk. Visual feedback guides the foot placement as you perform your step. Stimulates gait lengthening when the projection is set farther away than the patient's standard stride. Inline walking. Typical gait training exercise that is also very useful for balance, coordination, and proprioception. Visual feedback stimulates the patient to concentrate on executing the precise movement. Speed of execution: the slower it is, the more you seek fine movement and balance. Wide base walking. Specific gait training exercise to stimulate the enlargement of the base of support. The visual feedbacks are projected very externally so that the patient can reach them by widening the stride. It is very important that the patient does not extra-rotate the lower limb during advancement. Backward walking. Specific gait training exercise to stimulate balance, coordination, and posture. Visual feedback helps maintain attention and provide the correct rhythm when performing the gesture. By reducing the speed of execution, the monopedalic time is amplified, working on dynamic balance. Squat. It is the classic squat exercise with the addition of visual feedback to seek greater motor control and stability. The patient is required, during push-ups, to keep the feedback as stable as possible on the ground to counteract any instability. Heel walking. Specific exercise useful for stimulating dorsiflexion and anterior tibialis recruitment. Visual feedback helps to maintain attention and provide the ideal foothold by acting on the postural and balance system. By reducing the speed of execution, the monopedalic time is amplified, working on dynamic balance. Monopedalic squat. It is the classic monopedalic squat exercise with the addition of visual feedback to seek greater motor control and stability. The patient is required, during push-ups, to keep the feedback as stable as possible on the ground to counteract any instability. You can also squat on a proprioceptive platform to increase the difficulty. Dual tasking. It is possible to use cue walk to generate a double task required of the patient in order to work on programming and motor control, such as balance associated with movement. In this case, the patient is required to keep the visual feedback fixed to the ground, generated by the limb in support, and with the other limb perform circumduction movements. Turning. Very useful training in patients with Parkinson's to improve the often difficult phase of turning. Using one or two devices, you can work on expanding the turning radius, looking for greater safety and stability. The patient is required to turn by following and achieving the projected feedback. Extra rotation correction. In patients with an extra-rotational attitude, the use of feedback can help to increase awareness of the body's attitude. The patient is required to correct the pathological attitude by trying to maintain the feedback along a straight line by performing an intrarotational movement during the advancement of the step. Sit to stand. You can use cue walk as a tool to facilitate motor tasks, such as getting up from your chair. Feedback is very useful in patients with cognitive deficits, attentional deficits, or with neurological or neurodegenerative lesions. In this exercise, we take advantage of the feedback switch-off related to knee flexion. Hip extension. Exercise to be performed in a static position, so the patient is not required to advance. Feedback is used to increase awareness of the body's attitude in search of correction of the compensatory attitude of hip flexion. In this exercise, we take advantage of the switching off of the feedback related to knee flexion resulting from hip flexion. Knee extension. Exercise to be performed in a static position, so the patient is not required to advance. feedback is used to increase awareness of the body's attitude in search of correction of the compensatory attitude of knee flexion. In this exercise, we take advantage of the feedback switch off related to knee flexion. Obstacle avoidance. It is the classic exercise of overcoming the obstacle and returning to position, with the addition of visual feedback. The patient will have to overcome the obstacle and achieve visual feedback, thus seeking a more precise movement. Then return to the starting position. It is suggested to perform a full set with the same leg and then change limbs. Reaching out to physiotherapist. It is also possible to use cue walk worn by the physiotherapist to perform exercises in training guided and controlled by the physiotherapist himself. The patient is required to reach the targets generated by the physiotherapist's movements. In this way, the physiotherapist can have more control and guidance over the patient's movements. Very useful exercise in the early stages of training or when the degree of impairment is high. Cavalier servant, change of stance. It is the classic posture change exercise with the addition of visual feedback. The patient is required to switch from the cavalier servant position to the upright one, helping to maintain stability and balance with the visual feedback generated by cue walk. Walking on a treadmill. The exercise involves walking on a treadmill with the use of visual feedback. This training can be very useful in the phases of walking training on a treadmill. Visual feedback guides the foot's point of support. Walking with long strides. In this exercise, the patient is asked to walk while lengthening his stride a lot. Visual feedback helps to indicate the target to be reached and to maintain the length set by the physiotherapist. Slow walking. In this exercise, the patient is required to walk at a slower pace than their standard. Visual feedback helps to maintain the pace, the stride length indicated by the physiotherapist, and the accuracy of the movement. Fast walking. In this exercise, the patient is required to walk at a faster pace than his or her standard. Visual feedback helps to maintain the pace and stride length indicated by the physiotherapist.